your assumptions about the compliance levels of the public this time versus how they were behaving last year?
So yes, all the contemporary data that speaks to behavioural compliance is as contemporary as it can be. And those scrub surveys come through at regular intervals that give us some indication of that. They're probably not the main drivers. The infectiousness of the virus is a significant one, and the overall movement of people, which is a real-time data provision, are probably the key ones. Compliance is important, but it's not the overarching driver.
So is it fair to say that the assumptions that you're working on are that there is a lower level of compliance this time than there was last?
I think it will differ depending on areas. I don't know the exact details. That it's mostly external agencies that are plugging in the data related to that. Some areas are just as strong as during stage 4, through August, September. So it'll depend.
The Premier said a minute ago that he envisaged a situation in which these quarantine facilities might be required for a long time, even after we've been vaccinated. Can you explain why?
I think it's a brilliant idea to have quarantine facilities. We will all.
These quarantine facilities may continue to be required for this particular virus.
Well, it's certainly going to be several months before we get significant coverage through a vaccination program for the Australian population. That means that there will be an ongoing risk of transmission. We actually don't know. We know that the vaccines are terrific, both the Pfizer and the AstraZeneca, at protecting individuals from dying, from having severe illness. We are yet to really know with great clarity the extent to which they stop onward transmission of that virus, so people getting infected in the first place. So if there are ongoing cases and clusters, there'll be a need to isolate people and quarantine people.
Or dying, why do we care?
So there will be people who continue to get sick and die. When you've got coverage of everyone over 65 years of age, that means that you've reduced the risk across the population very substantially, but there are literally thousands of individuals in hospitals as we speak, in their 30s and 40s and 50s, who are dying or who are desperately unwell.
Who have been vaccinated?
No, people who are yet to have been covered by a vaccine. If we had, for example, 100% coverage with our vaccine, there's still 5% of the population who won't seroconvert, who won't get really good immunity. So there may well be, requirements for quarantine and isolation in those circumstances as well.
So just to make it clear, people need to understand that we could have vaccinated 95% of the population, and we could still be looking at a situation in which people come into this country quarantine for 14 days.
We don't know yet. That's a long, long way away. And as I say, there's not clarity or certainty around the effects on transmission from these vaccines. There's very encouraging data out of Israel at the moment, where for those who are over 60 years of age, who've almost universally been vaccinated now, that hospitalisation and transmission have decreased significantly. We need to see that for the AstraZeneca vaccine as well, and we need to see what it means for different cohorts of the population and whether there'll be further vaccines that are available and that have different characteristics and effects.
But on present trajectory, it's not going to change.
We don't know what the present trajectory is. We know that it's going to be very protective for hospitalisation and for serious illness. That's a great thing regardless.
Professor Sutton, at the current state of play, when's the earliest you would be comfortable having international flights come back into Melbourne?
Oh, it's not my call. Look, there are lots of competing decisions around that. It's a conversation between CQV, the Premier, Cabinet and others.
But on health advice, you're the one that provides that. When would you be most comfortable?
So it's not a health advice decision, it's a decision around multiple variables. So I'll provide my input into that conversation.
I don't know if it's for you or Jerome.
Yeah, all public events will also have health input in that regard, based on what comes through today and tomorrow.
Craig Riley has asked for, or said that he hopes that the crowd will return to 50%. Do you see that happening?
We will look at the data today and we'll make a decision and have conversations tomorrow morning.
Notifications were sent to, I think one of you has said 1,600 people who were in internal quarantine. Is that your understanding that that's all the people who are in internal quarantine? Because there seem to be others who haven't received Victorian notification and have released.
Oh, so those who were on outbound flights needed to be contacted by our interstate colleagues. So if they're on inbound flights, they're the manifest that we followed up, and Jerome can maybe speak more to that. But there'll be people who've gone to the airport with family, there'll be others who've gone there without being on a flight manifest necessarily. So there's some complexity to it, but for people who were leaving Victoria, it was agreed through AHPPC that those receiving jurisdictions would follow up those individuals. I'll let Jerome speak to it.
AstraZeneca.
Terrific news. Who wouldn't be delighted at the prospect of another vaccine, especially one locally manufactured that will deliver millions of doses to Australians. I can't wait to be vaccinated when my time in the queue comes, and looking forward to seeing it roll out across the country. I hope it lifts spirits. You know, the mental health anguish of this pandemic has been extraordinary, but it literally represents the beginning of the end of this pandemic as we roll out a vaccine. So it is incredibly positive to see that development, and to know that Pfizer vaccine will start to roll out in our hotel quarantine system, first ports of entry, our aged care and health sector staff and residents. So fantastic news.
Speaking of mental health, we saw lifelines swamped over the weekend as possible emergency departments as well with mental health patients. Do you acknowledge the toll that this lockdown is having on mental health, and how much did you weigh that on in making the recommendation?
Yeah, of course, these are terrible decisions to make, knowing what the effect is, and I know that Victorians are particularly sensitised to lockdowns because we went through a terrible second wave. That said, again, the alternative of having to face an outbreak that was out of control would have meant even more trauma for the Victorian people. Whenever we take actions, we are always trying to balance those risks, and you know, I hope Victorians recognise that I've always got their health and wellbeing in mind.
I'm not sure if you answered this before, but why is regional construction included in this lockdown? It's the first time we've ever had to shut down before.
Look, it's really that across-the-board set of legal directions to ensure that we've got a single set of directions across the state.
When I get updates on a couple of things, please, Brett. First, 19 working cases now. Have you got genomic results for how many of those?
The great majority, actually. I mean, those in the last couple of days, not, but before that, all of the B117 variant, and I've got every expectation these will be the same. They're epidemiologically linked to our known cases.
And any going in deeper to identify which individual may have infected another, or does that not particularly matter?
It doesn't particularly matter. We know that it came out of quarantine.
And also, the nebulizer issue, when it first came up, you've been talking about that as a working theory. Have you settled that?
Look, I think these things in the world of epidemiology always remain working hypotheses. It's not to say that coronavirus isn't incredibly contagious under normal circumstances. With a variant of concern, even more so. There is no denialism about airborne transmission from my point of view. This virus can transmit to others very easily, and when, I've said before, when you address the risk of close proximity transmission or droplet transmission, the transmission that you see is often airborne transmission. I know that nebulizers can increase that risk, and the epidemiological links are that those who are on that floor of the quarantine hotel when the nebulizer was in use, or on the days that was in use, that's the linkage, and that's why it supports that theory as opposed to other days when it wasn't in use.
And just the last one of updates, Emma.
Can I just ask a question?
Alex.
In the lockdown, we have seen in the previous lockdowns and especially on the towers that there was health advice that was provided that when it went to cabinet, the decision slightly deviated. For example, the timeline of when the tower should be locked down with one curfew. So in terms of your health advice for this lockdown, what we've ended up with, what are the decisions that were made at cabinet that weren't exactly for health advice?
With respect to this lockdown?
With respect
No, we come to an agreement whenever you sign directions, and I'm signing them at the moment, although there are delegated individuals who can do the same. I have to be entirely comfortable with signing them. So I take legal and moral responsibility for doing that. So whatever directions get laid down with my signature on them have my full support and agreement.
Given that those directions are going to cabinet and can't be released through normal FOI processes, would you be happy to release those so the general public can see the public health?
Oh, so they're not questions for me. The department has FOI processes. I'm not involved in the decisions about refusing release or otherwise.
Well, if you're talking about directions, Alex, the directions are publicly available.
With this 5 days of lockdown, what are you still most concerned about? What would it be, if anything, that restricts us from lifting it tomorrow?
Oh, I'm most concerned about the thing that comes completely out of left field, that, you know, we suddenly see a community case without links to our known cases. That can still happen. There are thousands of people who've been to exposure sites. Many of those have been tested. The great majority of those have been tested. That's really encouraging. But there might be someone who wasn't aware that that's been flagged as an exposure site, who nonetheless develops symptoms, gets tested and suddenly comes to our attention. If we can link it back, great. But if they've been in the community, had a number of contacts, that's a concern. I don't expect that to happen, but that's something I wouldn't like to see today.
Are you surprised when you advertise an extreme case, given how?
No, I don't think so. We have chased this down so rapidly. Whenever we have identified a new notification, so those close contacts, secondary close contacts, we've chased them down so quickly. So the fact that we're seeing cases emerge in those we've already identified is simply because of that. That's a terrific indictment of the enormously hard work the team's done. They have worked, I know because I get the emails, until the wee hours of the morning, and they've been absolutely tireless.
Brett, we know that we're getting roughly 11,000 Pfizer vaccines per week, 170,000 roughly frontline workers in Victoria. That's months to get them immunised, I suppose. Are you at all hopeful that the AstraZeneca announcement will speed that up, or how long do you think that process is going to take?
Yeah, look, it's really for the Commonwealth to speak to in terms of what the production capacity will be for the AstraZeneca vaccine, but the fact that it's been approved is obviously one of those critical steps. Manufacturing has been readied over recent months, and it would be great to see the production ramp up to a point where we can really start rolling out to those most at risk and those most at risk of severe illness.
The frontline workers are prepared that it's going to take a number of months.
I don't know. I think they're as keen as anyone to receive it. Obviously, they bore the brunt of the risk through this whole pandemic, so they're really keen to see it roll out as soon as possible. We'd all love to see that.
Just starting with vaccine. Am I correct in saying that people who have been vaccinated, we have very good data that virtually no one is dying who's been vaccinated? Indeed, we have very good data that people who have been vaccinated are not getting seriously ill. Is that correct?
That's correct.
So they're not contracting the long COVID that we're concerned about in addition to the people dying.
That's right.
Given that, once we reach a certain point of immunisation, I'd like you to think about what number that should be. Why would we worry about transmission if it's just causing people to become mildly ill?
So it certainly relates to the 5% of people who won't be protected even with a really good vaccine like the Pfizer and AstraZeneca vaccines. If those 5% are in aged care settings, are in other settings where transmission risk is really substantial, going from one person to another, then we should be concerned about that insufficient protection. That said, who wouldn't want the vast majority of the population vaccinated in order to protect against that risk? But it does mean, 1 in 3 people in aged care died when they got infected with COVID. And so you want a vaccine that provides 100% protection ideally. So even at 95%, there's a risk to people who remain vulnerable.
So even at 95%, what I guess I'm trying to clear up a bit is that even once we've been vaccinated, because of that 5%, we could conceivably be seeing scenarios like this unfold.
Look,
like what we're living through now.
No, I'm not sure that's the case, because we would have the great majority of people most at risk of severe illness, most at risk of dying, protected by that vaccine. At the moment, we wouldn't want to be in a situation where all of those people could be potentially exposed.
That's something I understand. No one's vaccinated here now. We're not talking about now. What I'm talking about is in 8 months, 9 months, 11 months, when the vast majority of people have been vaccinated. At what point can we say you're not going to lock us down again because of the 5% that you say this vaccine's never going to work for?
Perhaps that means. Well, those very questions